So today's lesson will be recapping what you've already learned from this chapter, Chapter 2, on PPE and hygiene. You already know your lesson objectives. We've gone over them last class. Now, this is a picture of an infection that was contracted due to lack of PPE. So this is why it's important to use your gloves. Now, a sick EMT can't take care of a sick patient. That's why it's important for you to wash your hands, use proper hygiene, and you definitely want to use the equipment that's provided to you. Now, personal hygiene, that can be considered showering, washing your hands, brushing your teeth. Now, of course, that maintains a professional appearance, but you want to make sure that you keep your hair clean. It prevents the spread of bacteria. Keeping your hands clean does the same thing, of course. Not just after you use the bathroom, but after you are in contact with each patient.
Right, so why would I bring an extra uniform if I already have a clean uniform?
Okay, you want to bring an extra uniform just in case you're in contact with some blood splatter, you get it all over yourself. You don't want to pass that on to your next patient.
Right, thank you.
So you know what PPE is?
Right, that's personal protective equipment, and that's used to keep you from getting any kind of disease or anything, contracting anything from a patient.
Right, and what's the most common type?
Gloves and eye protection, I believe.
Correct. So vinyl and latex are the two types that are usually used. Latex, there's an allergy to, so you want to have vinyl on hand if you need it.
Correct.
So now we're going to talk about how you take them off, properly disposing, and of course when you take them off and when you put them on. Now I've got a video I want to show you real fast.
Okay. That was a video, right?
Yes.
Okay.
It's just a quick video. Now see how he pulls that out. Doesn't take it well, he does take it completely off. I usually don't. But you want to ball it up in your hand.
Right.
And then you're going to slide your fingers underneath and then peel it out. And once you get it completely off, you're not touching any of the contents on the outside of the glove.
Right. That's to ensure you don't retract anything.
Correct. And it's like we were talking about earlier, you can get any type of
infectious disease.
Correct. If you have like a hangnail or something, some type of cut on your finger.
Right. Now, what did that other person have in the last picture that you showed? What was that you think?
That was herpes.
Okay.
You can contract just about anything from bodily fluids. Eye protection is important in case of blood splatter. Typically, you can use a mask with this or a face shield.
Okay.
So what are the two common types usually used? Do you know?
It's goggles is one, right?
Goggles and a face shield.
Okay, so face shield, like you were saying. Okay.
Face shield protects you from blood splatter.
Right.
So prescription glasses aren't really going to protect you from that. You're going to want to wear goggles over those, and especially contact lenses. They provide no protection for you. So consequences, of course, when you are dealing with your patients, you don't want to pass on any other bacteria to them that you may have gotten from another patient. So you always want to wash your hands before and after, just to be safe, and especially if you use the bathroom. You want to keep a clean appearance for yourself and for your patient. Creates a happier and healthier environment. And always stay away from scents, just like we talked about, because it can definitely spike up those allergies. You don't want to cause another problem for a patient that's already in there for something else. Okay, so just remember this picture when you're dealing with your patients, you definitely want to keep that PPE on. And so our next lesson, we're going to be talking about how we properly lift patients. You don't want to injure yourself in the work.
Right, and why is it important to use proper lifting techniques? Because
you don't want to injure yourself. You can't take care of your patient if you're sick or injured.
Right.
And we're going to have a written exam next class on hygiene and PPE.
All right, well, thank you for your time. Thank you very much.
Thank you.